Thanks so much for joining us today. Can you talk about the different factors in the shortage of mental health care providers across the state?
Yeah, I can. And this is a great question. And what we're seeing is really a supply problem and a demand problem. I think I'll start with demand first. And we've seen a couple factors increase the demand for mental health services in the state. Number one, obviously, is COVID. COVID has been a big stressor in many people's lives. And we know that a lot of folks are actually reaching out for help, reaching out for support, not just for grief and loss and depression, anxiety, increased substance use during that COVID pandemic, but we're also seeing it's a great benefit is that the stigma around counseling is less. So I think that's another big thing. Some of our public campaigns to reduce that stigma for counseling is paying off because we know more people want it. And unfortunately right now, we have quite a bit of a wait list. A lot of folks in the community are saying that they just aren't available to treat all the clients that are interested in their services. I think it adds to the extra factor is that I know Idaho has seen tremendous population growth. So with that population growth, I think we're also trying to adapt and kind of fix this, actually meet the demands of Idahoans for their mental health needs. Going to the supply side, I think that's a little bit more of a complicated problem because it takes time to produce highly qualified counselors. At ISU, we actually have a counseling program that's probably the largest in the state. We're actually located in Pocatello and Meridian campuses. We have almost, I think, 50 students every single year that are attracted to our program and stay within it and graduate. But to go through that program, it takes 2 to 3 years, and it's a 60-hour master's level program to get licensed. So we're really trying hard to kind of keep that supply side up to kind of meet the present demand. But there's other efforts that are being done with actually counseling specifically, and one of those is our Interstate Compact. Our National Association, the American Counseling Association, is sponsoring a lot of support for many states across the nation that they want to enact this interstate compact so we can break down interstate barriers between practice. And that really means that somebody in Idaho could actually practice in Ohio, practice in Washington, practice in Wyoming if they were to join this compact. And the same could be said for those other individuals in the states. And I think if we can actually join this compact, we're going to see a lot of success in getting counselors from outside the state, hopefully help to meet some of the needs for Idaho.
And so this ties into a lot of the red tape reduction efforts that the legislature and the executive branch have been working on for the past couple of years. And it seems like there are a lot of bonuses to this. Are there any downsides or any ways that this could be problematic for Idaho?
It's a great question in terms of what could be problematic. I think what we're looking for is how can we, actually protect the people in Idaho to get them to have the best services by well-trained professionals. And, there's so many different efforts about how we might go about that. But we really think that the best way to do it is actually through the compact by actually creating legislation in place that would reduce those interstate barriers. We do get people from outside of the state, and then we also are giving our sane people the chance to practice out of the state. So I think it's more fair than actually what we've seen in the kind of deregulation process or proposals for that. So I think that that's really hopefully what we want to see is the way to go.
But that means that Utah or Wyoming or these other states would also have to sign on, so there's reciprocity. We're not just losing Idaho mental health professionals, but we're also gaining.
Yes, and right now I know Wyoming is actually making significant strides in their efforts to actually pushing the compact through their state legislator.
We've spoke earlier in the program about the shortage of mental health professionals in north central Idaho, that District 2 region. Yeah. Rural areas, not just in Region 2, are really struggling with recruitment and retention for these mental health professionals. Is there any role for either Idaho State University or the legislature to help attract these new professionals to go to these rural areas?
There has been a lot of effort at ISU to actually look at grant funding for telehealth services and expanding the role of telehealth. And I think what we're finding is that the need to actually meet the needs of these communities involve many different factors. Actually having the providers, having the infrastructure in place like broadband internet, having the capability for the clients in these rural areas to actually connect with somebody through that, that's a big challenge. And I think Idaho is starting to take that challenge seriously and invest in some of that infrastructure. But I think maybe more personally for what we're doing at the university through our counseling department is we're growing quite a bit. And we belong to the Casca Division of Health Science at ISU, and we're tasked with kind of meeting the healthcare needs of the state of Idaho. And for the counseling side, what we're doing is creating and growing our program. We included many more faculty over the years, and we're upping our enrollment. And really, I think what is great to see is that we're having a lot more applicants apply to our program every single year. So, and I think that, for folks that are interested in becoming counselors, looking at our profession, you can do it in so many different ways. We have 5 specialty tracks. You can become a clinical mental health counselor, a school counselor, marriage, couple, family counselor, student affairs counselor, which works in university settings, but there's also a clinical rehabilitation counselor, which works with disability and helps people with disability.
As I'm listening to this, I'm curious, when we're talking about the specific mental health needs of certain populations, whether they're LGBTQ or our tribal members within the state, the Latino community, what is Idaho State University doing to address some of those populations?
Yeah, so ISU is really devoted, and especially our counseling department, to training ethical counselors and multicultural competent counselors. We have a lot of coursework that is involving how do you work effectively with diverse populations. And we actually try to work with our interns going to these rural areas or areas where they may be able to serve these kind of populations, such like the Latinx population. And how do you work to develop programming, or, and I think there's been talks about actually including more Spanish language acquisition for our counselors in training. And I know ISU has other programs that have actually benefited from that kind of, Spanish language kind of acquisition. Yeah.
Is there anything more that the state can do to help with recruitment and retention for mental health professionals, especially in those rural areas?
Yeah. I think what we need to do is invest in mental health. I think that is key. We know over the years that mental health has the same impact as physical health in individuals, and we need to take it more seriously. We need to look at, how are we actually supporting mental health counselors? And it is to a degree that, in school systems, we often have school counselors that have huge ratios of 500 students to one school counselor. And we actually think that's really, it's a disaster because each student does not get the proper need and support that they could get to be successful. So there's that at the school level, but also supporting higher education. I think higher education we are going to be the vehicle that is providing the mental health workforce for the future. And we need kind of support and encouragement, and I think from legislators, but also a community to kind of recruit and continue to train these high qualified counselors.
All right, Dr. Chad Yates, Idaho State University, thank you so much for joining us today.